Hello Health on LAE is presented by the Ochsner Health System, a nonprofit academic multi-specialty healthcare delivery system dedicated to patient care, research, and education. The Ochsner Health System includes 8 hospitals and 38 health centers located throughout Southeast Louisiana. Ochsner, healthcare with peace of mind.
We call it our More Money to Spoil Our Grandkids plan. With a Humana Medicare Advantage health plan, we get tips on how to make our money go further. We even get a health finance and benefits statement called Smart Summary that helps us find even more ways to save. And we like more.
More of what you want, because you deserve more.
Good evening, I'm Tom Bagwell, and welcome to Hello Health, a partnership with WLAE, the Ochsner Health System, and Humana to bring Ochsner's Hello Health weekly education and information series to television. Tonight's topic, migraine headaches. What makes them different than the ones most of us get? How are they diagnosed and treated? Are they preventable? And is there hope for patients suffering from chronic migraines? Our guest is neurologist Fawad A. In the second half hour of our program, we'll be taking your questions live by phone at 504-866-3200. That's 866-3200. Or you can send us questions by email to hhquestions@wlae.com. You can send the email questions right now. We'll get to the phone calls in the second half of our program. Well, Dr. Khan received his medical degree from the Deccan College of Medical Sciences in Hyderabad, India. He completed his residency in urology at the University of North Carolina Hospitals, that's in Chapel Hill. He completed his fellowship in neurophysiology and epilepsy at the University of Michigan in Ann Arbor. He is certified by the American Board of Psychiatry and Neurology, and it is our pleasure to welcome Dr. Fawad Ahmed Khan to Hello Health. Nice to have you with us on the program.
Thank you, Tom.
Yeah,
nice
thanks for being here. Well, what was it, or who was it, that first got you interested in medicine? This really wasn't the prescribed track in your family, right?
Right. I come from a family of engineers, and until high school, that's what I wanted to be. Until through my dad's job, we were living in India at that point, and I had firsthand exposure to the disease burden in India. You know, seeing the physician-patient ratio there made me really think about this, and I wanted to tackle diseases and challenges.
And how did you end up in your specific area of specialty?
Throughout medical school, I developed a keen interest in the brain and its functioning and how it controls the nervous system. And the diseases of the nervous system are very unique, and there's an exciting amount of research that goes into this, and that's sort of what caught my attention, and I decided to pursue a career and help patients suffering from these diseases. And
tell me a little bit about your family. I know you have a relatively new one.
Yes, I have a very, very cute 6-month-old. He's a bundle of joy, and I think I'm very blessed.
Very good. You saw the trouble in India and the doctor-patient ratio. Mm-hmm. Any interest in, we're glad you're here, we hope you stick around for a while, but any interest in heading back there one day to help?
Yes, I would definitely love to do that. During my residency, I participated in a charity clinic, and we're starting to set a foundation for that here in the city. And my wife and I and her family are working hard to establish this. So giving back to the community is a big thing for us.
Very good. Well, let's begin with the medical definition of a migraine headache, and how is it different than the headaches that most of us get?
So migraines are very unique. They're unique because they comprise of several different components, and it's these components that make it not only complex, but very disabling. And this has been studied extensively. In the United States, people who suffer from chronic migraines, only 30% of them can hold a full-time job. And I can show you in a Canadian study, in the next image here, it's interesting to know that about 90% of people who suffer from migraine headaches say that they're unable to perform just daily activities, household chores for that matter. 30% were forced to cancel family and social activities, and about 67% of them live in this fear of letting other people down.
What is the diagnostic criteria looking at migraine headaches?
So the International Classification for Headaches recently proposed a revised diagnostic criteria in this year, and according to that criteria, there's several different elements. So a patient must have at least 5 or more attacks, which are more than 4 hours in duration, and should have certain components that include nausea, vomiting, photophobia and phonophobia, which essentially is pain with exposure to sound and light.
Mm-hmm.
Other criteria also include a unilateral headache, one side or the other, a pulsating quality to this headache, moderate to severe intensity, and aggravation by physical activity or motion.
Okay. How common are migraine headaches?
So migraine is not a new disease. We've known this disease for a very long time. Hippocrates described this back in the 600 BC. Dr. Willis, who's a father of neurology, specifically wrote a chapter about migraines in his textbook. The prevalence of migraine, which is the actual percentage of patients who have this disorder in the population, is about 10%, 5 to 6% in males, 14 to 18% in females. Unfortunately, this is a very underdiagnosed condition. As you can tell from this chart, it's the 3rd most common disorder on the planet, the 7th most disabling disorder on the planet, and among women it's the 4th most disabling disorder. And within the field of neurology, this is the most disabling disorder.
Mm-hmm. And surveys, I know you wanted to talk about those tonight.
Right, and so through several different surveys across the globe, and these are surveys on patients who have chronic headaches. When you put in the diagnostic criteria, you find that most of the patients, and up to 94% of the patients who say they have headaches, actually have migraines. They've done surveys in Europe where they did a telephone survey, picked up the phone randomly and asked people, do you have this criteria and do you suffer from headaches? And about 40% of people who picked up the phone said they have migraine headaches. So this is severely underdiagnosed, and a lot of this is due to the fact that there's a misconception with regards to what a migraine means. And the most common misconception is a chronic headache, which people attribute to sinus headaches. Mm-hmm. In a landmark study, as you can tell in this image here, that patients with migraine headaches can develop nasal congestion. So it's unfortunate that many of these patients go to several different physicians, including primary care doctors and ENT physicians, and try numerous courses of antibiotics and do not get better, because there's no such thing as a chronic sinus headache. There's an acute sinus headache with purulent discharge, illness, and fever, but there's no such thing as a chronic sinus headaches, and most of those patients who were a decade ago have been classified as migraine headaches. So this is an underrepresented condition.
I want to go off script here for just a moment. You see patients with migraines all the time.
Correct.
How do patients, in layman's terms, how do patients describe them? And I was talking to someone around the office just the other day. He said in some cases they are so severe, patients contemplate taking their own life. Can you take me through the different levels of severity of migraine headaches, the stories you hear in the office on a regular basis?
Sure. So to objectively classify this, we have a scale of 1 to 10, and I ask patients, can you tell me how bad your pain is? And they look at the scale. We have a measure of what 10 is, and I said 10 is the worst headache of your life, and they'll say 12, 14. And every 10 minutes, someone presents to an emergency room throughout the United States with an acute headache, which is a migraine headache. And so it's bad enough for them to present to the emergency room. They're willing to wait the hours, come all the way, because it is that severe.
Have you ever heard from one of your patients that they have considered taking their own life? That the pain was that severe?
No, I haven't, per se.
Okay. What do we know what causes migraine headaches? And in part 2, I'm going to add to that, you mentioned more women get them than men. Do we know why that's the case?
So to answer your first question, the culprit of migraine headaches is a small nucleus in the brain. It's called the trigeminal nucleus, and that's a centered, deep-seated part of the brain.
I think we can show people what that looks like.
Right.
There you go.
And that's the area which is responsible. That supplies sensory nerves throughout the skull and the head region and controls pain modulation. So it's the overexcitation or the overactivation of this nucleus that causes migraines.
Okay. And do we know why more women get migraines than men?
So we've realized and recognized over time that several factors contribute to worsening migraines, and several internal factors, and one of them are hormones. And in women, we think it's related to estrogen. It's the actual dip in estrogen that they perceive right before their menstrual period or during their menstrual period that can actually precipitate a migraine headache per se. Whereas men don't necessarily go through these fluctuations in hormones, and we think that probably accounts for the double prevalence of migraines in women as opposed to men.
Okay. Are there different types, and I'm assuming there are, different types of migraine headaches?
Right. So migraines have traditionally been classified in many different ways, whether it's a pathological classification or with or without, or the classification that I am particularly interested in is now getting increasing recognition, is about the actual mechanism behind migraine, which has the greatest bearing on treatment. So we classify it between episodic migraine and chronic migraine. And in simple terms, chronic migraine is when you have more than 15 headaches a month, essentially half the month. An episodic migraine is less than 15 headaches. Now, as simple as this definition is, the pathophysiology behind this definition is far more complex.
Let's delve into that.
Yes. And so an episodic migraine, as opposed to a chronic migraine, is less disabling. The economic burden of a chronic migraine, even though it's a simple number of greater than 15, is about 4.4-fold.
Okay. And this is how often you get them, but does this deal in any way with the severity of the headaches?
Not necessarily the severity. Patients can have different types of episodic migraines, mild, moderate, and severe. Most of these are triggered, and there are several different triggers which are associated with episodic migraine. They can be internal factors, like we talked about hormones. It can be stress, lack of sleep. There can be external factors, certain sounds, certain frequencies. There can be dietary factors, and certain medications can do this. Weather change can precipitate this. And that's all under the loom of episodic migraines.
Okay.
Chronic migraines, on the other hand, are a different category, and primarily because they involve chronic inflammation.
Okay. You mentioned it's a very disabling disorder. How do migraine headaches explain this degree of disability, and what makes the difference from any other headache?
The several components that are associated with the migraine are what actually cause the disability. And now we know that nearly 12% of patients who suffer from chronic migraines are disabled. And the reason being is that migraines evolve in terms of a clinical presentation.
Yeah, let's talk about some of these pre-migraine symptoms now.
So you can start out with what's called a prodrome. And if we go through this image here, we're looking at several features: depression, drowsiness, anxiety, irritability, muscle tension, yawning, cognitive dysfunction. And if you were employed or were busy with a particular activity, it's very difficult to be engaging because of these symptoms. Then you have the aura, which usually typically precedes a migraine, and this can be associated with a lot of neurological symptoms, anywhere between weakness and sensory symptoms or visual symptoms, and this in itself can be quite disabling. The migraine itself can be associated with pain, intractable or severe nausea, and generalized pain. And then there's a postdrome, which is what follows a migraine. And a postdrome can be associated with depression, irritability, anxiety, loss of sleep, and appetite, and that can go on for several hours, to up to 3 days. So as you can tell, in this gamut of symptoms, the most common symptoms are the disabling symptoms.
Okay.
Outside the pain.
Okay. Just because we're talking about headaches, and I'm going to ask you about over-the-counter medications in a moment, but just the difference between acetaminophen and ibuprofen for regular headaches first, because I'm sure people interested in headaches would probably want to know the difference. When do I take which one?
So the key thing in migraines is timing. If you can take a medication as soon as the migraine starts, you can mitigate the rest of the inflammatory process, which accounts for all the different elements of migraine. Now, whether you do well on acetaminophen or you do well on over-the-counter non-steroidal anti-inflammatory medications, it's an individual choice.
Okay.
But you do have to be careful here when you're looking at over-the-counter medications, because it's very easy to overdose yourself. Now, for instance, someone takes prescription pain medications for a chronic headache and then decides to take 1 or 2 extra Tylenol during the day and then maybe a Tylenol PM. So you've already accumulated more than 3,000 milligrams of acetaminophen, and that's toxic to the liver. And we know this because if you look at studies in the last decade, we've achieved great success with advancement in science and technology in reducing morbidity and mortality in various diseases. And regardless, we still have a 4-fold increase in death due to acetaminophen toxicity. And that's because of the indiscriminate use of this.
And physiologically, what's happening with the acetaminophen, and how is it helping the migraine or any other headache for that matter?
So we think migraines start with an inflammatory process. There's a cascade of neurohormones which change in the brain, and that leads to vasodilatation, the throbbing sensation and the pain, and then the aura or the postdrome. If we can stop this inflammation early on with a reasonably good dose of Tylenol or any non-steroidal anti-inflammatory medication, this process can stop.
Okay. Let's talk about some of the treatment options beyond over-the-counter medications for migraines.
Okay. So for a migraine attack in itself, what you really want to do is you want to treat the individual components of the migraine. Okay. As you can see the next image here, several medications, anti-inflammatory medications, triptans, caffeine can block the pain itself. And then you have the intractable nausea, the dizziness, the hypersensitivity, and all these elements have specific treatments outlined. And so this is how you would treat an acute attack. Now, if this goes on and people have more frequent attacks, then we're looking at preventive medications that people take on an everyday basis to help prevent headaches.
Okay, and we're going to talk about treatment for chronic migraine in this next image, right?
Yes. So chronic migraines are different because they are associated with inflammation. They're also associated with sort of a feedback loop that happens between hypersensitized nerves and the brain's ability to perceive pain. And when this loop is building up, then it's a different pathology altogether. And many of the traditional medications don't work. And so over years of targeted research, we found that botulinum toxin is a very effective therapy. In fact, that's the only therapy that's approved by the FDA. And so we're starting now use botulinum toxin to help treat chronic migraines.
It's the same Botox that women and I guess some men are using to
it's the same,
change their appearance?
Right, it's the same Botox. It has a cosmetic use and also a therapeutic use.
Okay, and you're using it? And some of your patients are using it.
Correct. I am using it.
And what are you finding?
So I find this to be a very effective therapy. And when we're trying to establish or understand therapy, we're using what's called this responder rate. So for instance, if you said you have chronic migraines, so more than 15 a month, okay, let's say you have 24 migraines, okay, and you say, well, I was 24 migraines and after therapy my migraines dropped to 12. Well, that's a 50% reduction. If you say you had 24 migraines and they drop to 6, that's a 75% reduction. So when we're looking at 50% reduction, within the first year of doing Botox therapy, 40% of patients say they have success. And then as you go on beyond a year, 70% patients. And then when you're looking at a 75% reduction, but a quarter of the patients who get this therapy. And this therapy is effective as you continue on. And this is one of its kind therapy, which works the longer you take it.
Okay. There are some side effects with Botox, and you wanted to talk about those tonight.
Yes. So Botox is a bioactive substance. It's foreign to the body. and it's a toxin. And so it is associated with side effects. The dosages that we use for chronic migraines is very low. Regardless, the data that has been pulled from the 3 large clinical trials discusses several different side effects.
Let's show those to our viewers right now. There we go.
Right. So most common is neck pain. It's more of a neck ache and soreness that patients can get, which can last between 2 to 3 weeks. Headaches in itself can occur depending on how the therapy is administered, how the injections are done. And then if the toxin spreads, by virtue of gravity down to the eyelids, they can be droopy of the eyelids, it can spread to other muscles in the body and can cause weakness, which can last 2 to 3 weeks.
And how are the injections? They are injections, and how are they given and where are they given?
So there are 31 sites throughout the head and neck and up to the shoulder region, which is where we inject this through a very small needle, and we inject almost 0.5 cc at each location. So.
Okay. Our guest tonight is Dr. Fawad Ahmed Khan, and tonight we're talking about migraine headaches. We're getting ready to take your questions at 504-866-3200. That's 504-866-3200. We also want to hear if you are someone who suffers from migraines and just want to share your story with us. We're happy to take those tonight as well. Or you can send us email questions at hhquestions@wlae.com. You can send those email questions and start calling right now. Well, doctor, can migraine headaches be prevented?
Absolutely. They can be prevented. There's several different strategies that are involved. Genetically, you may have a predisposition for migraine, but if you choose to change different elements of your lifestyle, yes, they can. So several things that we can do. Number one is avoiding triggers. And a lot of it is patient education, understanding what your triggers may potentially be. For instance, monosodium glutamate, MSG, as we know it, is a potent trigger for migraine headaches. It stimulates the nerves in the tongue, and that's what makes food taste better. But it also stimulates the nucleus, which is responsible for migraine headaches. So that's one of the things we can do. Improving sleep is another strong component. Over time, as stress increases in our life, there's a degradation of our sleep pattern. And that accounts for lack of rest that the brain needs on a day-to-day basis.
Overweight being a factor as
Absolutely.
well? Obesity?
Obesity is a factor. That's part of the chronic inflammation that is associated with chronic weight gain and obesity.
And what about exercise?
So migraines are directly related to general well-being and staying fit. And by virtue of exercise, not only are you reducing your risk for high blood pressure, you're also reducing your risk for migraine headaches.
Another reason to get to the gym or take that walk around the block.
Absolutely.
And finally, what's being done, doctor, at the national level in the area of migraine headaches to try to call attention to this disorder that affects so many?
Right. So we know that 36 million people in the United States of America suffer from migraine headaches. And despite that large number, we have very little funding from the National Institute of Health to promote migraine research. And so a joint collaborative effort between the American Migraine Foundation and Mrs. Cindy McCain, they established what's called the 36 Million Migraine Campaign. It's a national campaign, and I'm supportive of this campaign. And what this essentially does is it mobilizes people to understand and to reach out to patients who suffer from migraine headaches. It also increases awareness and increases the nation's research interest and funding for migraines.
Very good. Again, if you have questions about migraine headaches or just want to share your story, you can call us right now. 504-866-3200 is our number, 866-3200, or send us questions through email at hhquestions@wlae.com. We're back with your questions and more of our program in just a moment.
My name is Joan Mollahan. I'd like to invite you to join me at Oxnard Health System's Moonlight Miracles Gala at the Superdome on Friday, November 15th. Funds raised will benefit cancer programs at Oxnard, the largest nonprofit system in the Gulf South, to provide multidisciplinary care for adult and pediatric cancer patients. I've been supporting Oxnard philanthropy for 14 years. As a breast cancer survivor, I know today's gift is tomorrow's miracle.
You're watching WLAE, New Orleans Public Television. Find us on Cox Channel 14, Charter Channel 11 and 711, AT&T Channel 32 and 1032, Dish TV, DirecTV, and over-the-air broadcast on Channel 32.
Because play might be the best way to fight obesity.
Because staying connected makes my family stronger.
Because a safe place after school can lead to success in school.
Because physical activity is vital to my health and well-being.
Because I need to make my world better.
Because playing team sports teaches character and social skills.
Because we need each other.
Because we need each other.
Because we need each other.
Welcome back to Hello Health on WLAE. Tonight we're talking about migraine headaches with Dr. Fawad Ahmed Khan. You can ask your questions right now by calling us at 504-866-3200. And let's get right to our questions. Let's start on line 4. By the way, we're also asking you to share your stories tonight if you suffer from migraine headaches. Line 4, Mark is waiting for Metairie. Mark, welcome to Hello Health. Good to have you with us on the program.
Hello, sir. I suffer, and so does my daughter. And my question is for my daughter. She's trying to get pregnant. She's 35 years old, and she suffers with migraines. And we'd like to know what medicines are safe for her to take now or when she gets pregnant.
Okay. Well, thank you, Mark. That definitely is a challenge. And it all depends on how chronic or how severe her migraines are. There are only a select few medications that can be taken safely during pregnancy, not to mention that any medication is unsafe for the fetus. If you had to choose between simpler medications, I would choose something like topiramate, and I would start at a very low dose and see if that is effective. I do have some patients who have tried several medications during their early pregnancy and have found no benefit. And in these patients, I typically do interventional procedures. I do injections, because what you're doing is you're minimizing the risk on the fetus with medications that are given through injections, as opposed to taking something orally. And they're pretty effective during pregnancy.
Mark, would you mind sharing your own story about migraine headaches, when you started getting them, and how severe are they for you?
I had one in 2000, one in 2009, and I just had one on September the 20th where I actually thought I was having a TIA, a transient ischemic attack, because I didn't know that much about migraines, because I had a dark spot and couldn't see through that dark spot, and I had trouble speaking about a half an hour later. And it was the first time I experienced this with my migraines, because before I just had pain. This time I had the dark spot and the trouble speaking before I had any pain, which was kind of strange to me. And I'm gone and had it all checked out at the hospital, so I'm okay now.
Okay. Very, very good, Mark. Thank you so much for sharing your story, and best of luck to you and to your daughter during her time of pregnancy. The symptoms Mark described almost sounded like stroke symptoms.
Correct. Mm-hmm.
We haven't talked about dark circles or any of these other things. Mm-hmm. Are there symptoms that the difference between a stroke and a migraine, so that might be helpful to people tonight?
So this is a challenging area. When patients do present with these features and they present in an emergency room, they definitely do look like a stroke. One way to sort of distinguish this is to have an understanding of the patient's history, whether they have risk factors for stroke, and that would steer you into that direction of stroke, or whether they have a prior history of migraine headaches or typical symptoms in the past. these symptoms that he's describing are auras, which precede a migraine. And that is, in fact, due to decreased blood supply to certain parts of the brain. And so the loss of vision that he's experiencing is secondary to that. The timing and the severity and its relationship to headache tells us, especially in the acute circumstances, whether this is a migraine versus a stroke.
It sounds like Mark made the right decision in getting to the hospital as fast as possible.
Absolutely.
Okay. Let's go to line 5, where Lee is holding from River Ridge. Lee, thank you for your patience and welcome to Hello Health.
Thank you. I want to get right to it. Doctor, I know this is hard for you to believe, but I get migraine headaches every day. I've taken Excedrin for years, Vanquish. I've taken, they've given me Imitrex. I've taken, sometimes they get so severe that I'll take Imitrex on top of Phenerin. They also give me that also. And what it feels like, it's a feeling that starts in the back of my neck and goes upward. I get them about 10 o'clock every morning. What I do is I have to take something. I either take an Excedrin or a Vanquish, and it seems to help it for a little while. But you're right, I do have problems with diet, certain things I cannot eat. You talked about monosodium glutamate, that triggers it right away. But I've been enjoying the show, and I've gotten some tips, and I do want to make an appointment to see you. I'll hang up, and thanks for being on.
Lee, thank you very much for your call. Any thoughts about Lee's?
So it looks like what Lee is suffering from is what's called a status migrainosis. That's when you have a migraine after a migraine, and now it's a chain reaction. And this is very difficult to control once you go into that sort of a chain reaction. And like I said, a lot of it is inflammation. There are centers around the country where they admit the patient to the hospital and essentially treat inflammation with strong medications. In addition, what he describes as pain coming from the back, and it seems to be very stereotypical, it could be a pinched nerve. And that's what essentially it's doing, is it's setting off the migraine. And if we can somehow treat or block that nerve, I think we can stop the process.
Okay. Our phone number is 504-866-3200. That's 504-866-3200, and we do have open phone lines. Doctor, I also wanted to ask you, earlier you talked about hormones, that one of the difference, one of the reasons more women may get migraines than men is hormones. With adjusted hormones, can you then adjust migraines?
Yes. So the drop in estrogen is what's perceived to cause or precipitate migraines, and you can take certain birth control pills that can alter hormones or change the basic composition of hormones and the ratios, which can actually be used to help treat migraine. So it is possible. Estrogen supplements are used in some females. They're typically adolescents who have severe menstrual migraines, and they do take estrogen supplements the day of or the day after, which helps them.
Okay. We've heard from people on both ends of the spectrum. One caller who gets them every day, another caller who's gotten 3 within about a 10-year period. But we're looking for your stories tonight, for you to share your stories about migraines and, of course, taking your questions for Dr. Khan tonight. We do have an email question to get to, Doctor, and here it is. Okay. I get migraines periodically. I typically take 3 Advils to get relief. Is this okay? This is from Teresa in Metairie. Thanks, Teresa.
Okay. Well, it seems from this email that the 3 Advils do the job. And every individual is different. There are several different non-steroidal anti-inflammatory medications. And if 3 Advil do the job, that's great. If she's needing to take more and more and they're not doing the job, then we can change the medication to a different category medication, which I think would help her. So it really depends on the individual. I have some patients who say they take ibuprofen and it doesn't do a thing, and they take naproxen and it's great for them.
Our phone number, 866-3200, 866-3200. At what age do people who are going to start getting migraines, where do you usually start to see that kick in? What's the youngest patient you've ever seen, and what's the oldest patient you've ever seen?
So we've identified approximately 10 genes which are responsible for this. So there's a strong genetic predisposition. And it really depends on how many family members also suffer from chronic migraines. I've had patients who say as long as they could remember. I've had patients who said that when they were in kindergarten that they would be taken home because they could not stop throwing up and they would hold their head. So even at a very early age, they can start. But most patients during midlife, when the stress sort of increases in life, that's when they'll start experiencing them if they haven't already.
You mean when they start working?
Or college.
Or college, exactly. Let's go to line 1 where Phyllis is calling us from Metairie tonight. Phyllis, welcome to Hello Health. You're on with Dr. Khan.
Hello, this is Phyllis.
Yes, Phyllis,
Hello,
go right
Phyllis.
ahead.
My question to the doctor is twofold. Could this be the propensity to have migraines be hereditary? My mother suffered from them severely, and of course they knew very little about that back in the 40s. And some of my children and grandchildren can get these. And also, could champagne or wine cause these? If I drink champagne or red wine, I get a severe headache.
Yes, thank you, Phyllis. So I was telling Tom earlier that migraines do come with a genetic predisposition. It is an inheritable disorder, so it is very likely that if you've had family members or parents or grandparents who suffered from migraine headaches, that you can, and not only you, your children and grandchildren can suffer from migraine headaches.
What about the trigger? She mentioned red wine.
Right, and so every individual is different, and in some individuals, alcohol in itself can be a trigger. In some individuals, red wine alone or white wine alone. So absolutely possible that that's a potent trigger for you.
Okay. I've been told by a friend of mine bad red wine is a trigger, but not necessarily good red wine. So
Yes.
I don't know if that's a fact or not.
It could be the age.
Could be the age, yes. Well, let's go to line 2 where Cody is calling us from Metairie this evening. Cody, welcome. You're on Hello Health with Dr. Khan.
Hi, Dr. Khan. I'm so glad you're on television. For the last 3 weeks, I have had migraines, and I was taking over-the-counter medication, and then I went back to the Imitrex that I usually take for migraines. I've never had them this long. Every morning, about 4 or 5 o'clock in the morning, I start like my head's ready to just blow off. And I took an Imitrex today, and it still hasn't gone away. I started about 2 months ago with a cold and the flu, which evidently went into my sinuses, and I take a steroid. I spray a steroid for my sinuses, and I take Zyrtec. Well, that wasn't helping, and I don't know what to do. I have an appointment with an internist tomorrow to find out what to do, because I've never had migraines this long.
Okay. Well, thank you, Cody. It seems like you suffer from migraine headaches, and you have been for a while, since you're quite familiar with the drugs that are used for migraine headaches. The fact that you have now a prolonged migraine, and one which has rebound components to this, and it started after a presumed sinus infection, I would have this evaluated. I think you're doing the right thing by seeing an internist, because yes, it's not normal to have more severe or more prolonged migraines in a patient who has migraine, and usually there's a trigger, whether it's systemic illness or a change in lifestyle. But in addition to that, you need to worry, given your age, if you have a change in quality of your migraines, which is different from before, and given in terms of length or severity, that could mean something more serious.
Okay.
And it could be just masked by the fact that you perceive that you're just having more frequent headaches.
Now, is the internist the right place to start, or should she go straight to a neurologist?
Well, traditionally, patients will see their internist first, and then they will see a neurologist or a headache specialist. And the workup here that needs to be done is usually a set of blood tests and possible MRI imaging of the head.
Okay. Cody, thank you so much. Let's go to line 3 where Sandra is calling us from Bush, Louisiana tonight. Sandra, welcome. You're on with Dr. Fawad Khan.
Yes, I'm calling about my husband. He complains with headaches every day. It starts like up the neck, and sometimes it's across the head in the front. I was wondering what the doctor would say about that. He's had blood work done. He's had MRIs done. But he complains every day, and he takes anything that I buy, he takes for it.
Okay. Well, thank you. It's hard to know just by the description what kind of headache this is. There are several different headache syndromes out there, and based on associated symptoms, the physician can tell you what kind of headaches he's suffering from. But it seems like the way it starts in the back of the head and comes to the front, there is a subcategory of headaches called an occipital neuralgia, and that may be what he's suffering from. And it's really a pinched nerve in the back of his head. And also, the second component is that he's taking a lot of medications on a fairly regular basis to help control this. And headaches are one of the rare pain syndromes in the body that the more pain medication, especially over-the-counter medications you take, the worse it gets. So then you have to sort of shift gear, and your physician has to prescribe you medications that are very specific to the type of either neuralgia form pain or migraine pain that he's experiencing to actually help him, because he'll hit a ceiling where it's not going to work anymore.
If what you described is what he has, and there'd be some more questions you'd have to ask, would that fall by medical definition under migraines or into a separate category?
It's a separate category. It can transform into a migraine. But in itself, it's a different entity.
Okay. Sandra, thank you so much for your call tonight. 866-3200 is our number, 866-3200. We're also taking questions by email at hhquestions@wlae.com. Let's go to Tommy, who's calling us on line 4 tonight. Tommy, what's your story?
Good evening, Tom. Good show, Doctor. Very good show. Very informative. Doctor, I have a question. The acupuncture treatment to the head, is that effective and do you recommend it?
Okay.
Not something we've talked about yet tonight. Correct. Thank you, Tommy, for your question.
So several alternative therapies do exist for migraines that can range from herbal therapies to acupuncture to physical therapy. Acupuncture has been effective. It all really depends on who is administering the acupuncture. If you feel that this person is qualified and recognized by the board, the American Board of Acupuncture specialists, then yes, I'd go ahead with this. Traditionally, the acupuncture that is performed for migraine headaches is not necessarily done on the scalp. It's done on the neck and on the hands. So you might want to inquire about this.
Okay. Tommy, thank you so much for your question. A good one. Let's go to line 5. Lewis is next, calling us from Metairie this evening. Lewis, you're on Hello Health with Dr. Khan.
Hello, Dr. Khan.
Hello.
I was a migraine headache victim for about 14 years. I had them every day. I blacked out behind the steering wheel of my vehicle on the Airline Highway. The EMS come out there and they tried to put oxygen on me, which was the worst thing they could do. They put a bag and made me breathe in the bag, and they had gotten a hold of my doctor, so he told them put the bag on me. And my problem was for about 14 years. I got rid of it when I went to Dr. Caron's, and he burned windows in my sinuses above my eye and below the eye on the cheeks. As in 1981. I haven't had a headache since. It relieved the pressure. And some of the patients I've heard on the news tonight, they're having the same problem with pressure in their head and their eyes, their sinus infection. They ought to maybe look into that nose job. It's gruesome, but it's worth it.
Mm-hmm.
Lewis, thank you for sharing your story. Let's talk about, and we did chat about it earlier, the relationship between nasal and migraines.
Right. So migraines can be associated with nasal congestion. That's in association with the overactivation of the parasympathetic nervous system of the skull. And it is common for patients who perceive that this is a sinus infection, but in fact, those are migraine headaches. It all really depends on the quality of pain that he's experiencing. If it is isolated just to the sinus region, and it only flares up every time he feels sick, and it goes away with antibiotics, then that in fact is a sinus infection. Neither the sinus infection nor migraines have been associated with true loss of consciousness.
Okay. Are you aware of cases where rhinoplasty has deviated, the correction of deviated septums has made a difference with people in migraine headaches?
So it could be that the sinus infection is a precipitant of the migraine headache. And by treating the sinus infection or the chronic obstruction to the nasal cavity, that their migraines are treated. The other thing is that sleep apnea has been associated with migraine headaches. And untreated sleep apnea will make that worse. And by having what he mentions a nose job done, they can actually treat that. And as a secondary effect, their migraines get better.
It worked for Lewis. Lewis, thank you for sharing your story with us tonight. Let's go back to the phones. By the way, we do have some phone lines open at 866-3200, and we'll keep that number there at the bottom of our screen. Let's go to Lizette, who's calling us from Kenner tonight. Lizette, welcome to Hello Health.
Hi, thank you. My question is, I had Arnold Chiari, and I had my first surgery when I was 21. I had the craniotomy, and then later on I had some issues with the vertebrae in my neck, so then I had a spinal fusion, which caused trouble because they had, the back of the skull removed. My issue is that the occipital neuralgia, the two main nerves that shoot from the bottom of my neck up to the top of my head, the crown of my head, they feel like lightning bolts constantly, 24 hours a day, every day, and I'm on 900 milligrams of Neurontin, and it doesn't seem like it's helping to numb it in any way. I was wondering if you know of anything that could help to just take that pain level down for me.
Mm-hmm. Right. Well, sorry to hear, Lizette. There are several options for you. There are medications which are more effective than Neurontin that you're currently taking that can help reduce this pain. I would definitely try those medications. There are nerve blocks, which is a procedure when they use lidocaine, the same thing dentists use to numb your mouth, and some steroids to help relax and treat some of this chronic stretch and inflammation that the nerves are experiencing. There are certain surgeries which help, but it seems like you've had an awful lot of surgery already. There are other therapies like stimulators that can be placed over these nerves, which can help essentially electrically turn off the nerve.
Lizette, thank you. I hope we've given you some options to consider with Dr. Khan. Phone line's still open, 866-3200, 866-3200, or send us questions by email. And here's another one we've received. Doctor, I have tried to eliminate caffeine from my diet but get horrible headaches. Can you offer any suggestions to alleviate my symptoms? This is from Darlene. Darlene, thank you for your question tonight.
Okay. So, thank you, Darlene. Caffeine per se is not traditionally associated with migraine headaches. It's the overuse of caffeine which can be a challenge. I typically tell my patients up to 200 milligrams a day and no more than that, and then try to take caffeine at the same time every day so that you're avoiding the fluctuation. Now, trying to get off of caffeine can be challenging.
How many cups of coffee or how many soda pops is? Two. Okay.
Two, yeah. Mm-hmm. Trying to get off of caffeine can be very challenging. Caffeine in itself is a very strong vasoconstrictor. And then when you're trying to get off it, you're going to get a rebound, which is the opposite effect, where now you're getting vasodilatation. There are certain medications which also have a mimicking effect to caffeine, and some people use those medications as a bridge to slowly come off of caffeine. So that may be something. Prodrin is a drug that can be used. And other migraine medications or pain medications themselves can be used. Anti-inflammatory medications can be used as a short bridge while you're coming off the caffeine. It's going to be a slow process, but it is possible to come off. And if you try to do it abruptly, then that's going to be the hardest.
Yeah, my wife gave up Diet Coke, and when she did, she had severe, absolute severe headaches, which eventually completely went away.
They will.
And so did the Diet Coke. So, but it took a while.
Yes.
Okay, let's go back to our phones. Claire calling us from Kenner this evening. Claire, welcome to Hello Health.
Hi. I'm calling. I had migraines all my life. I just seen this morning Dr. Jolly, they was talking about putting a stimulator for migraines. Then I go to the pain clinic, and I was asking them this morning about me getting a stimulator for my arthritis pain and my migraines. What do you think about that?
Okay. So Claire, stimulators are quite effective for the treatment of migraine headaches, and it works best when people have chronic migraines and sort of an overactivation of the nerves. The area that's responsible, the trigeminal nerve, is very small and very deep-seated into the brain, that we cannot turn that nerve off. But the two largest branches of that nerve are, in fact, the nerves in the back of your head. And if we can turn those branches off, theoretically, we can turn off this center and stop the headaches. And it has been successful. A lot of it depends on where you get it done in the procedure. And you want to talk to people who've had it done, who found it successful. But yes, it is an effective tool to help stop migraine headaches and avoid increasing dose of medications.
Just since you've been in medicine, what are some of the advances that have been made in treating migraine headaches?
So a lot of the advances are with drug discovery and device discovery. There are several medications in the pipeline which they're trying to use for migraines based on experiments they have done. And they are still going through phase 2 and phase 3 clinical trials. So once we have those available, we'll know. But the promise is greater than 60%, which is more than what we've had with any drug so far. Mm-hmm. With devices, several devices have been approved in Europe, which are small portable magnetic devices to large devices done in the clinic through various stimulators of the nerves of the head and the neck. So there's a lot of exciting research which is going on, and a lot of this is trying to approach migraine from a different perspective.
Is there anything out there that you know people are using that's being pushed, maybe even supplements that you know for a fact and medical research shows us don't work?
They don't work. Mm-hmm. There are certain herbal compounds that were perceived to work in the past, and so we've stopped using those. They're
such as
feverfew. Okay, we know that they're associated with greater degree of side effects than the actual perceived potential benefit from this. Certain medications, for example, carbamazepine was used for many years. It has too many side effects and it's not effective in migraine headaches.
Okay. Our phone number is 504-866-3200. We do have just a little bit of time left if you'd like to get in a final question before we leave you tonight. And at the end of the night, I'm going to ask the doctor, does he think there will be a day that all of our patients tonight who've described these symptoms with migraine headaches, that we can do away with migraine headaches forever? I'll ask him if he thinks that day is coming. Back to our email questions now. Does insurance cover Botox injection for migraines? Good question.
So botulinum toxin, or Botox therapy, was approved by the FDA in 2010. So by virtue of this approval, insurance companies have to consider this as an effective therapy. Typically, insurance company will want you to try at least 4 or 6 or 7 medications before you can be approved for Botox therapy. So as long as you're consistent with the physician and you've proven this, then yes, they do.
Okay. Let's go back to our phones. Line 6, Joanne calling us from Pearl River tonight. Joanne, welcome to Hello Health.
Hi. My question is, it's not migraine headaches. It's when I get stressed or when somebody kind of yells at me or something. The top of my head and the back. And I'm a juvenile diabetic, and it's painful. But once I relax, it goes away. At one time, like last month, it used to feel like something was pouring in my head, and I went to a neurologist, and I couldn't get into the MRI machine to get it taken care of, to see what it was. Do you, when you stress out, do you know what I'm talking about? The top of your head and the back.
Okay. So when you look at the way the human anatomy of the head is designed, there are several different muscles which surround the scalp. The most dense muscles are the ones in the temple, right at the top of the head and at the back. And if this is the distribution of your pain, and especially when they're brought on very quickly, then that pain typically is associated with what's called tension headaches. And as soon as you relax, you feel better, and that goes away. So that's muscle tension. That's muscles contracting. It's almost like if you held your hand up above your head for an hour or two, you'd feel that same pain, and that's exactly what you're experiencing.
Okay, and we're going to get to Alice here in just a moment. You talked about herbal therapy, I think, earlier in the program. We didn't really get into any details.
Right.
What are some of the uses there and some of the results?
So the results are mostly conflicting. We don't have any therapy which is known to be effective, and a lot of this has to do with some of the way the clinical trials were structured. Some of them are flawed. And don't provide any effective data that can be used. There's no great comparison between these drugs or these herbal supplements with the approved drugs for migraine headache. And none of the studies have shown any benefit long enough to be meaningful. And none of them have gone that far because of perceived side effects from these medications.
Okay, and our final question of the night will be Alice, calling us from New Orleans this evening. Alice, you've got our final question for Dr. Khan.
Yes, Dr. Khan. I'm calling for my daughter and my grandson. My daughter been having these, I think, since she started a freshman in high school. I don't understand them. She's gone to every doctor. She's now on Botox, and I'm concerned about that. My grandson, he throws up with them. He's in college. So, I don't know. I'm worried.
Yes, Alice, I do understand your worry because it seems like this is a life-altering disease for both your grandson and your daughter. Finding the right therapy is somewhat an art, and finding the right combination for an individual is really important here. And it has to be a comprehensive approach. It has to be lifestyle changes, dietary changes, and the right medications. You can't just pick up one therapy and say this is going to do it all, and let that be Botox or anything for that matter. So what they really need is sort of a comprehensive evaluation and finding the right therapy for this. And that may take some time, but once you do find that, that's going to be the most effective thing, because you're really trying to focus on reducing the suffering and improving quality of life, and with the right medication with minimal side effects. And it's possible.
And is that the overriding message you want Alice and our other callers tonight and all of our viewers to know, that there is hope for people suffering with severe pain and the associated symptoms with migraine?
Absolutely. There is hope, and it has to be a strategic approach.
Okay. And if I had you back here 5 years from now, or when should I have you back, do you think we will have the answer? And do you think the answer is coming where we can do away with migraines altogether?
I'm not sure that would be a reality. I don't think we can get away with it altogether, because that's just part of how our brains are wired. But I think through research, we can find ways to help mitigate this to the best of our ability.
And lessen the symptoms.
Absolutely.
Okay. Well, I want to thank Dr. Khan for the education and information he's provided tonight, and for his work in the Ochsner Health System. Thank you so much, Doctor.
Thank you.
Very educational program tonight. Now, here's a preview of what's ahead with Hello Health on TV. On Monday, November the 11th, Doctors Philip Orvitz and Victoria Smith will show us how to take charge of our health care. We'll talk about preventive care and ways to avoid duplication of tests, less complications, and proven lower health care costs in this new world of healthcare reform. That's Hello Health, only on WLAE on November 11th. To make an appointment with any Ochsner physician, including Dr. Khan, or to register for any of Ochsner's Hello Health seminars, you can call Ochsner at 504-842-5669. That's 842-5669. And I'd encourage you to take a look at those seminars. They happen across our area almost on a weekly basis. As a reminder, you can rewatch tonight's presentation or any of our Hello Health programs on our website at WLAE.com or on Ochsner's website at ochsner.org. Just type Hello Health in the search areas to get started. Our thanks again to tonight's guest. Thanks to Humana and Ochsner for making this program possible. And our final thanks, as always, is to you for your support of this program, Hello Health, and our station, WLAE.